This is a P.A.S. Report podcast sound clip. Listen to the full episode by going to the PASreport.com, iTunes, or any major podcast platform.
Americans are unhealthy. We have so much chronic illness in our society that has rendered us vulnerable to COVID-19. That's who's dying right now, our elderly, but then our chronically ill, those who are obese, overweight, heart disease, lung disease, kidney disease, diabetes, you name it. That's who's dying in the United States. Sweden's obesity rate is less than 9%. The United States is up to 43%. And the obesity in itself is one of the highest risk factors for death with COVID-19 here in the United States. We cannot ignore that. So no, it is our own bad behaviors that has rendered us vulnerable to this viral infection. You want to compare yourself to Sweden? You want to act like Sweden? Eat appropriately, exercise more, live a healthier life. Unfortunately, we didn't do that before this happened.
That's a great point that you're bringing up. And your book, Make America Healthy Again, which if people go to the PASreport.com, they could actually find links to your website. They could find links to the book to purchase the book. You explain how much money this unhealthy lifestyle is costing the United States, where we could just make simple fixes. Can you just tell our audience a little bit about the financial costs involved with this?
I did a lot of research in my book because I feel that, so my defense mechanism when I am trying to look at crisis or look at problems is intellectualizing things. If I can really understand something, then in my opinion, it's better. So when I was here, the reason I wrote this book is, you hear everybody, clamoring on one side, single payer, the other side, private health insurance, blah, blah, blah. I have my own opinions on what I like as a as a physician as well as, a patient. But the bottom line is, and what I kind of found out doing research for my book is, it doesn't matter what kind of policy you support or, what you want, nothing's going to work because our system is so overrun with costly medical illness, largely which could be preventable.
This is a P.A.S. Report podcast sound clip.
Be sure to rate, share, and subscribe to the podcast so you'll never miss an episode. Also, visit PASreport.com and follow us on Twitter at PAS Report.